progression of Parkinson's disease. Go. Coenzyme Q10. All right, so we had actually at one point or the other, any of these drugs have been under study. NIH has studied creatine and minocycline in 2 previous trials, but creatine and coenzyme Q10 are the ones that are active currently in clinical trials, so the answer is A and B. And I'll talk more about those. Minocycline had some darkening of the teeth effect in some patients and some side effects. It was less well tolerated compared to the others, so NIH pushed forward with creatine as the winner to try to slow Parkinson's down. Okay, the coenzyme Q10 is a chemical that's in all of our bodies, and it helps you make energy in the form of ATP, the energy substance of the whole body. CoQ10 is decreased in Parkinson's patients in numerous studies, and in 2002, Cliff Schultz did a trial showing that different doses of coenzyme Q10 may actually provide reduction in progression of Parkinson's disease in a short-term, underpowered trial. There's only 80 patients or so at different doses, 20 in each arm. However, the Parkinson's study group, we're conducting a trial soon in untreated PD patients of coenzyme Q10 to see if it slows it down. They discovered in that early trial that 1,200 milligrams per day is a good dose, or the best dose to use for possibly disease-slowing effects. However, this trial that's coming up is going to have 1,200 or 2,400 milligrams per day. How much does it cost? Well, 1,200 milligrams per day currently is about $200 a day. So patients that are planning to take this drug shouldn't fool around with real low doses. They should take the high dose, and typically my wealthier patients take it if they're going to. I don't really highly recommend it yet, but certainly if you have the jack, do it. It's safe and well tolerated. There's also a NIH clinical trial that we're doing currently, and this drug, creatine, is being studied in this. So folks, this is an interesting design. It's kind of a natural type trial. Folks have early treated Parkinson's disease, so they can be on levodopa or they can be on dopamine agonists or other drugs, and then you randomize them to either creatine or placebo, and then follow them for 5 years on either one of those drugs to see how they do. Unfortunately, in my opinion, we may be putting all our eggs in one basket because there's no interim analysis planned for the 5-year study. I think what if we get to 5 years of spending millions and millions on this study and we find bupkis or find that it's a negative study? So we're looking for ways to identify whether a drug slows Parkinson's down sooner, but really only following patients for many years is a way to tell if they're different. A 1-year study, in my opinion, doesn't tell me that I've slowed disease, because it could be just slight treatment effects that changed in a short period of time, not the whole disease over many years. Okay, how about restoring function? Why not replace the dopaminergic nerve cells that die in Parkinson's disease? And this has been done. Everybody's excited in all fields, including Michael J. Fox, about stem cells. Stem cells hold great promise, I think. And now with the new administration in here, there's going to be probably a lot more stem cell stuff that comes along. Actually, soon after Obama came in office, I heard the other day that a trial that had been put on hold during the Bush administration has now gone forward by a company called Geron. And Geron is going to be doing stem cell transplants in patients with spinal cord injury. But actually, they took dopaminergic nerve cells from the brains. This is a controversial study that was done here, published, I think, in 2002. But they took dopaminergic nerve cells from the brains of patients, of aborted embryos, and they actually implanted them into the brains of advanced Parkinson's patients. They selected 40 patients that were about 34 to 75 years old, and in a double-blind study with sham surgery. So they actually drilled a hole in the noggin of these folks that got sham surgery and did not put the cells in the brain, but made a hole so they thought they had some sort of surgery, so did the clinicians. They knew that too. And then half of them got the fetal dopamine nerve cells in both sides of the brain, and the measured outcome was an improvement in a global rating scale. So what happened? In a normal brain there with this float of a pet, as I mentioned, red and yellow indicate high levels of dopamine in the brain there. You can see there in a normal brain on the left, there's a nice comma shape there with lots of red in both sides of the brain. However, in folks with Parkinson's disease, the tail end of that comma kind of fades away, the red part. You can see there in the upper left before surgery, there's only a little bit of red in the caudate nucleus up there and very little at the end of the comma down below. After surgery, though, you put those dopamine-making nerve cells in there. There's lots of dopamine there on the right made in the brains. In a sham surgery patient, you see decent amounts of dopamine initially, followed by progression of loss over time. So they're losing dopamine, as I mentioned, throughout the disease. So the transplanted dopamine neurons did survive, but patients 60 and younger had significant improvement, but not the older patients. 15 to 50% of patients had what we call runaway dyskinesias. In other words, you could not stop these twisting and writhing movements in them because there was just so much dopamine around. They just twisted and writhed all the time. This research is in a holding pattern. What I think this illustrates to you is that folks that think that stem cells, just by putting them in the brain, they're going to fix everything. No. They have to, first of all, hook up to the right nerve cells and establish the right architecture again, and that's very hard to do in a diseased brain. And they have to make the right amount of substance, that is dopamine and other chemicals, to work appropriately as well. So it's going to be hard to recreate what God or evolution created. How about trying to treat patients with a growth factor? Actually, there was some evidence that infusing a chemical called glial cell line-derived neurotrophic factor in the brains of patients, or GDNF, was helpful. As you can see here, again, red is dopamine. In a little area where the catheter is, there on the left-hand side before GDNF, and that little ellipse in the center of the rectangle, there's no red. However, after 12 months of infusion of the GDNF, you can see a little red in the ellipse there. So there's a little bit of dopamine dopamine being made there. No serious clinical problems at 1 year. Dyskinesias are reduced. This is like all open-label studies that have occurred, including the recent gene therapy trials. But a large-scale trial was actually done and funded by a company and aborted by Amgen. And on 60 Minutes, you may have seen the story Cure Interrupted, because some of the patients thought they were much better. But in a double-blind fashion, the trial was negative. So this has been pretty much aborted as well. We have trials for untreated Parkinson's patients looking at possible disease-slowing therapies going on right now. As I mentioned, there's the CoQ10 for untreated folks. There's a large simple study which looks at creatine versus placebo. We'd love to see any patients that are treated for that if they've had early Parkinson's. And we also have studies for wearing off and dyskinesias and studies looking at possible biomarkers coming up. We'll see any new patient you suspect has Parkinson's in a week at our place here if you'd like to refer, and just put a plug in for our practice here. Also, we have a National Parkinson Foundation program where we'd like to come help educate folks, either patients or physicians in rural areas, also in other places, cities even, to help out, help them become aware and proficient with Parkinson's disease and provide the best care for your patients. Please call us if you're interested in having us come out, or if we could partner with you and help you learn more about Parkinson's and take better care of your patients. And I'd like to thank you for attending the program, and we'd like you to please fill out the survey that you see there on the SurveyMonkey web link.
Well, that ends our seminar. Thank you, Dr. Morgan, for your time and willingness to share your information and experiences. Also, thanks to all of you who participated. We're glad that you could join us and hope the session was helpful for you. Don't forget to fill out the online evaluation to receive your CME credit. Please take the time to click on the survey link that is located on the screen. If you're unable to click on that link, an email will be sent to you with the survey. Thank you again, and enjoy the rest of your day.